How's it going, folks? Here we are. It is Monday the 23rd. Locally sourced. Peterborough and Monadnock local news. Covers some national stuff too, but for the most part, try to keep it local. Today's show, we are going to be talking about where New Hampshire is at currently, with our control or lack thereof of the pandemic that's happening. We had our first reported death today. Very first death. The number of tests in the state went up to 870 pending tests. We've had over 2,400 tests total. We now have 101 individuals confirmed to have COVID-19, up 23 from yesterday. The man who died from COVID-19 was over 60 years old, had multiple pre-existing conditions, so that's exactly the high-risk group. Things for us to consider. We did have a case of coronavirus reported in New Ipswich. We're going to talk about that a little bit. Sununu won't issue shelter in place and has been calling this the flu. Been comparing it to the flu. There was an update from Dan Feltis on Facebook this morning. We'll go over the Peterborough business list. Corky Messner decided he wanted to get partisan, so I'll show a clip of that. Let's see here. Kind of go over a little bit what's happening down in Washington with the bills there and that aid, and talk a little bit about that because everything that I see is super confusing. So yeah, we'll give that a shot. And see here, Rand Paul tested positive and Mitt Romney is now in isolation. I think Mike Lee is as well. On the national side of things, Biden finally came back after a week, only to give us a 16-minute live stream and like a 1 minute and 20-second bump video. So that happened. And with that, I think we'll just start getting into it. So some stuff on the local side of things. We'll just, I do want to just sort of get to yesterday's COVID-19 update, which is now a little bit different from where we had been, unfortunately. Just push this up onto the screen right now. So here is the March 22nd update. I'll check throughout the stream to see if they post the 23rd, but I have a feeling that won't go up until later today. We'll just have to sort of hang in there with that. But we did have the report from Dr. Chan, who let us know, and we'll show the video of that here in just a minute. I just wanted to do a quick check on this to see if they've updated yet. Okay. Yes, they have updated. Let's see. We now have, looks like, according to the website, there's actually 889 persons with tests pending. And sounds like, yes, 850 being monitored as is currently reported. We don't have an update from the 23rd yet, so we'll just stick to this right here. Here's our map. We know this is now out of date, unfortunately. This is not going to be reflective of what the current numbers are, so we just sort of have to... This was yesterday. Keep in mind, this is now up to over 101. And even today, on WMUR, Sununu is openly admitting that this is going to get much, much worse, and we're going to see this just climb and climb and climb over the next 2 weeks. It's just, that's how it's going to be. and this is going to be tough. If you are in that high risk pool, and let's be really clear, the high risk pool is really big, okay? And in our town, in this state, with an aging population, I deeply worry for a lot of people in our town. I'm really concerned about it. This is, this is hitting people really hard, and I've been driving around, for this or that. Mostly I don't get out of my car when I'm doing it, or I just go exactly where I need to and then get right back in. But frankly, I have witnessed a lot of people just not being that careful in terms of proximity to each other. And something I do want to talk about today is specific information about how this virus works, specifically related to some autopsies and testing that was coming out of Wuhan in China, which essentially talks about the ways in which this is transmitted. And it's important to understand that when you're transmitting this particular virus, it's mostly done through aerosolized saliva or mucus. So that's why the social distancing is so important. When you're within 6 feet of somebody, the likelihood that you could just be talking or get too involved or say, overpronounce one T wrong, and you will essentially spray invisible amounts of saliva out in a space. It's pretty gross, but it happens all the time. We just ignore it because we don't know it is even going on. But that's the primary transmission method. It's way less likely to be transmitted through a smear, and even if you do say eat it, it's not going to grow in your digestive tract. This virus has to come in contact with the tissue leading to your lungs. It has to come into contact with lung tissue in order for it to propagate. So that it is obviously important, sterilize all your groceries when you get them into the house. Protect yourself when you're out in public. If you are near anybody that's high risk, or you see anybody that's high risk, or you're concerned about that, wear a mask. Make sure to take all of those same precautions that person who is sick would. That's really important. It's really, really crucial to do that stuff. So let's see here. We have had regular updates. If you're in the Peterborough community, there's probably a high likelihood that you've joined the Peterborough Cares During COVID-19 group that went up from like 300 something to over 600 participants. I know they have to keep it really under control there, but there is a lot of good up-to-date information. It gets posted in, I don't even know how many times a day at this point. It's really frequent. So definitely check that as a resource. I wanted to try and spend some time aggregating other things from outside so that we can sort of just have a separate understanding. There's a lot of local focus, which is super important, but we do sort of have to keep our eye on the ball in terms of what's happening on a broad scale. And I don't really encourage everybody to just go consuming tons of news. I think it's going to make everybody freak out and really just, it's not good. So I'll do it. It doesn't bother me. It's for whatever reason, it's not, I'm not necessarily concerned for myself, although I worry for a lot of other folks. So it's worth looking at for me. At any rate, geez. Okay. Well, let's just get into this WMUR clip. I mean, it's really kind of it's pretty intense. And I'll just sort of we'll let the clip roll and we'll let it speak for itself. So we'll put this up right now. Here we go.
Good afternoon, and thank you, Governor. So I want to give a brief update in terms of the numbers for what we're seeing in New Hampshire for COVID-19, and then some additional public health recommendations for our communities. So to date, over the last 3 weeks, since our public health laboratory first brought on COVID-19 testing, our public health laboratories has tested over 2,400 people for COVID-19, and there are an additional 870 tests pending currently. So we have certainly ramped up testing for COVID-19 in our state. We are now announcing 101 individuals with COVID-19. That's an increase of 23 individuals from what we announced yesterday, and we will continue to release daily updates. The majority of these individuals are travel related, either domestic or international travel related, but we are seeing a number of individuals in various communities and counties throughout the state who have no clearly identified risk factors of contact with a confirmed COVID-19 case or travel. And this indicates that there is and continues to be community transmission of COVID-19 in multiple areas of our state. 11 individuals have been hospitalized with this disease. And I have the unfortunate news that today we're announcing the first individual in New Hampshire who has died from COVID-19. And I want to express our sympathies for the family and friends of this individual. This is an unfortunate situation and one that we certainly want to try and avoid, but we know that with this virus, it can cause serious illness and even death in those who are more susceptible to serious infection. This individual that passed away over the weekend was an adult male who was over the age of 60 from Hillsborough County and had multiple underlying chronic health conditions. This is the exact group of individuals that is at highest risk for serious COVID-19 related complications, such as hospitalization and even death. So I want to use this opportunity also to acknowledge that as a community, we need to do what we can to protect the more vulnerable individuals in our communities. And to Governor Sununu's point, we want to stress the importance of social distancing. Now, what does that mean? Social distancing means that people, when they are out, should maintain a distance of at least 6 feet from other people around them. If someone doesn't need to go out for an urgent or emergent issue, we encourage them certainly to stay home and certainly away from public gatherings of individuals. We know that many people are already doing this, but we want to stress again the importance of social distancing as a mechanism to slow the spread of COVID-19. As you've heard over the weekend and today, we have an increasing number of cases. This is expected and can be expected to increase in the coming days. And so we ask that everybody in their communities do what they can to limit the spread of this virus and protect those who are more vulnerable in our communities, for more vulnerable to serious complications of infection. I want to also acknowledge a question that we get often about whether somebody can potentially transmit the virus early in the onset of symptoms and possibly pre-symptomatically or asymptomatically transmit the virus. And I want to acknowledge that there does appear to be increasing evidence that this happens and potentially is one of the drivers of this pandemic. And for that reason, if someone has been exposed to another person with COVID-19, meaning they're a close contact, whether that person is confirmed to have COVID-19 or suspected to have COVID-19, those individuals need to take the extra step of staying at home and quarantining themselves to prevent further spread in our communities. We have stressed before the importance of anybody who has even mild symptoms of staying home. That remains the case. We also want to stress the importance of people that may be asked to quarantine at home, meaning stay at home, because of potential exposure, that those individuals please do so. I want a couple additional points here. Anybody that is more vulnerable to COVID-19, so people that are 60 years of age and older, or people with multiple chronic medical conditions, we want to ask those individuals especially to stay home as much as possible, limit contact with others. As the number of people with COVID-19 increases in our communities, the risk of acquiring this from our communities is increasing. And so these individuals particularly need to pay particular attention to remaining at home and practicing social distancing. And again, that is maintaining at least 6 feet, being within 6 feet of other people, avoiding being within 6 feet of other people, and staying home as much as possible. For these individuals, we encourage them to have at least a month's supply of medications on hand, and a supply of food and groceries. In these times, we also ask community members to reach out and support others in our community who may need a hand, who may need to make a trip to the grocery store, but are trying to limit their social outings. We encourage people in our communities to look around and reach out to others to see how we can best support those who we want to certainly protect.
So this is all really valuable information, but just to that end, um, if you are a service worker, right? If you're somebody who's volunteering, you're getting out here and you're trying to do good and get around. If you're working at a grocery store right now, it's really imperative that you take the social distancing aspect seriously when you're around customers. Okay, this is like super, super, super important. Or when you're delivering anything. For a couple different reasons. One, because you could you never know what you've got going on, and as was just pointed out, you'll remain asymptomatic but still be transmitting the virus. So that's probably the one of the most concerning things about this, is that we can be showing no symptoms and be spreading it around. But to that end, if it were to go the other way, okay, and you as the aide gets sick, this will put you out for like 2 weeks at least, if you're gonna recover from this. Okay, if you actually recover from this particular coronavirus, right? It's gonna knock you out for a really long time. And something we have to keep in mind is that we cannot be all rushing to volunteer on that at once and putting ourselves in jeopardy. Okay, it's important to maintain a level of temperedness about jumping into stuff, and knowing exactly what measures you need to take to avoid those situations. There's a lot of instructions, and I'll actually show the MCH specifically shared PDF that they have up on their website. We'll go over that in a moment. But it's really key to keep this stuff in mind, and think about the bigger picture. I know a lot of people, you know, is up here. I know a lot of people who say, oh, I'm hardy, I'm okay. It's it's good. Like I get out, I walk, I eat healthy, and it's very difficult for us to truly understand this until it's in our homes. Even coming up here, I mean, was it Friday? I showed clips from an Italian hospital, and I mean, even that isn't necessarily enough to drive the point all the way home, because it's like you just shut that video off and leave it, and it's not in your face constantly, and that's the difference here. So it's just this is why, and I mean, I don't want to be making everybody freak out, okay, but because in a lot of ways it's like you need to be less afraid of the things that you're touching. Maybe not, I mean, maybe not less afraid, but or even, I mean, you need to, it's not the surfaces that you need to be as concerned with, mainly because every time you touch a surface, if you're out and you say touch a doorknob at a grocery store, okay? You touch a surface going through a grocery store, and then you go out to your car and you get in your car, and then you drive home, and you walk back into your house, and you go through maybe one or two different doors there. Every single time that you've touched something, you've reduced the viral load. Like, you're diluting the amount that can get in, and then it's also additionally not in as readily available a form for you to inhale. It's not like, because that would be the way that it gets transmitted. And the reason it's so effective at transmitting is because we don't think about 6 feet as enough distance. And I mean, and this is observable for me just talking to folks around, is that I will actively try myself to keep 6 feet of distance, and it's hard because people keep stepping forward. It's like we have this desire to have like maybe like I mean 4 feet, like 3, 4 feet in between us, when we're talking to each other, and that is how it transmits. That's why this is so intense, because that proximity and having conversation, like that, literally, that's it. All you have to do is be close to somebody and talk to them, and that's why it spreads like wildfire. It's not because, or not as much so because we are really bad at touching our faces all the time. I'm not saying that it's not something that you need to be concerned with all the time. Okay? Absolutely. Do not touch your face. Wash your hands constantly. Every time you go anywhere, wash your hands, because just just because the viral load reduces or something, like, doesn't mean that like, if you pick your nose, you're done. You know what I mean? Like, if you got an itch on your nose, it's over. So, and that is smear transmission. That's not aerosol transmission, okay? So it's important to understand that, like, you still got to be concerned with all this other stuff, but to know exactly where the weight needs to be applied when you're concerning yourself with what to do. Okay. Let's get on to some better things, I guess. Max Makerspace will be donating or working to build 3D print a whole bunch of face shields, because, again, a face shield is a bit more effective than a mask, and especially for healthcare workers. And MCH has been very, very open about the fact that they need more resources. So let's see here. I'm gonna put up this. So this is the MCH website right now, and they are indeed requesting a lot of resources. So goggles, gloves, hand sanitizer, face shields, isolation gowns, unused face masks, anything like that. So if you got any of that stuff, donate it. Donate it to MCH. They are welcoming fabric mask covers from the community. Let's see here. What I can do now is I can pop up. Let's see. Just want to make sure that I can get this. Okay. There we go. We will do it this way instead. Okay. So here is the hospital mask cover PDF that's supplied directly by MCH. I'll make sure that there's a link to this in the description so that everybody can pull this up specifically. I've seen a lot of different patterns get posted. I've even posted other patterns. As they go up, as more information becomes clear, I'm going to update things. So please keep current with our episodes if you're able to, because this information is always going to be changing. Right. So we'll just scroll over this for the time being, so that if anybody just wants to kind of pause the video and read this stuff, they are more than welcome to. And then there's also the visible pattern here. And this can be found directly through MCH's website right here. And again, we'll have a link in the description for that as well. So, everybody will have direct access to this stuff. And then we'll pop over, and then here's the makerspace update. We're still waiting. We're to just sort of get the funding in to help produce these face shields, although they have already started printing them, as seen by the photo up here. So that's nice news that we're there. It's here we go. Sorry, didn't have that up there for a second. All right, so yeah, here we are. And this is that face shield. So they have been directly contacted to make visors, specifically because it'll block anything that comes at it. It's not just there's no opportunity for anything to get through. You know, this virus will not go through impenetrable solid materials, like plastic or anything else like that. So it's important to acknowledge that. We're going to switch over to this here. This is so because moving along, this is the New Ipswich story. This is a little bit older. I mean, like 2 days old. It's not. I mean, I say older. It's really quite current. So younger guy, 25, symptom free for about 2 weeks. Tracks with the virus. Lungs started to feel full of junk, and shortness of breath and fatigue intensified. Even going upstairs would win me. And this is a 25-year-old, folks. A 25-year-old is saying that going upstairs would win him. So, really, 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 really please take the severity of this seriously. It is a slow rise. It's not, you're not gonna know what's going on until it's just already on you. And this was travel related. Talks about taking the test, how, put it up there, had it sit there for 10 seconds. This looks like it's a different kind of test since the turnaround was 4 to 5 days. I think there's different tests are going to give you different turnaround times. Something to keep in mind that and then there's also a resource issue when it comes to the availability of swabs and stuff like that to get the test to happen. So that was something that had been talked about, and I think it was an NHPR piece that talked about in a previous episode. So you go back and check out the descriptions there. I try to keep the links of all this stuff that I put up on the screen in every episode so that people can do their own tracking through. Anywho, so, and I think, for me, there's one, this is super, super salient right here. At first I thought it was hogwash, like they were blowing it out of proportion. It's definitely a real thing. It isn't fear-mongering to talk about this like it's a problem. The death toll is going up like crazy around the world. That's our measurement. And when I get into some of the more national stuff in a bit, that's when, it's difficult for us to see those impacts here in our state for a variety of different reasons. you know, I think because of just the nature of people in New Hampshire and how we like to stay in and or be, privately out on trails, I think, like it's just we are super duper isolated in our space, and it's really easy to forget what the rest of the world is like, or what the way things are actually operating. And it's also really difficult for us to sometimes comprehend that it's really easy for that stuff to seep into our world and for us to not notice it, and really start affecting things. That we can really easily run into the same problems and be totally oblivious to it because we think we just, oh, well, that doesn't happen here, that's not part of our problem. We're a smart, intelligent community. We're run by people who are experts in their field. We're well educated, and we're, fairly affluent, and it's all that stuff is going to mean literally nothing because we think it's the thing that's going to protect us. And it could really be a thing that keeps us blind to doing exactly what we need to do. So please, just, I mean, as a rule, I would ask the older community to just, for yourselves, for the rest of us, we care about you. We don't want anything to happen. Please, please stay in. Just stay in. It's not worth it. It's really not worth it. Um, you know, try your best to, if you need to go out, is like really, really social distance. If it's not somebody who's in your household, like somebody you just straight up live with, at which point that person is probably required to exhibit the same levels of caution that you would take, if not more. Unless it's somebody in your household like that, don't don't get in 6 feet. It's pretty easy. It's pretty easy. And something that I had seen was, it's don't think about it as social distancing. Think about it as physical distancing and social solidarity. And I want to credit my friend Emma, because she was the one that I had originally seen share that. Um, and I think that's a really great way to put it. That this is you are showing that you care about people by physically distancing yourself. If you're going out, if you're getting, if you're having a close face-to-face conversation, like that's not, you might feel like that's exactly how you'd show that you care somebody, but right now that's upside down. And we got to do it like this. Yeah. So, fun times that we live in. On the plus side, again, there have been a lot of really awesome. There's a lot of awesome streaming music and streaming instructional videos and stuff like that that's happening right now. So people can definitely hop online and try and find some of those resources. A lot of that stuff is available. I know local musician Charlie Chronopoulos has been killing it on Facebook most nights lately. He's just out here jamming out and taking requests. So I know if you wanna get in on that, or like that request tip, you got to get in there early. Hit him up soon. Don't try to hop into the stream last minute and give him stuff, because he's not going to be able to meet you with that. But as stuff like that happens, I'm gonna try and document it and talk about it here. Let's see here. I know that there are a lot of resources you can get at through NPR Music. If you hop over to their website, there's links and lists there. This is a really great time for folks to dive into just like the deep, infinite depths of internet creativity. I personally spent a really long time doing that myself, um, and just putting in work there, but I mean, it's like, I mean, you're talking not, mist in a bucket, if that, uh, I, for whatever I did. And there's just so much good stuff out there in terms of music, in terms of instructional content. A lot of it is just free and available to you on YouTube. It's definitely make sure to, you know, gauge your, like, use your best judgment. Don't just watch random stuff and think everything's going to tell you the right thing. If there's ever a time that we need to have a critical eye on stuff, it's now. Um, and and absolutely keep in mind, everybody, too. Please be careful on the internet right now. One of the things that they were, I believe I had mentioned this previously, but it's one of those things that was going through was this behind the scenes when we're not looking, was an attempt to essentially undo end-to-end encryption, which would do away with all of our privacy. Even more than we already have it gone now. I mean, we literally would not be able to lock anything. The government would be able to just waltz into literally any of our private accounts and just have a look. Legally speaking, they would have a legal grounds to do it. And although, was it Blumenthal and Graham, and although they said, oh well, encryption doesn't show up anywhere in this bill, just because you don't use the word doesn't mean that you can't find a way to affect it through other policy. And that's a neat trick of politics. So it's important for us to be mindful of our freedoms on the internet as we're going out and we're reaching into our communities to share more stuff like what I'm doing with these live streams. But it's like, hey, when you're not doing your live stream, take a little piece of tape and stick it over your camera. you know uh that's what I do. I mean, we don't necessarily do it exactly that way, but it's essentially the same thing. Be careful with yourself on the internet, even more so now than you were before, because so much of our lives has shifted to the internet. And I know that folks are just spending most of their days in Zoom conferences, which is fine, I guess. It's what we got to do. Um, so yeah. Anyways, moving on a little bit. So yeah, okay, we'll pull this up a little bit because it's just important to understand that, like, okay, so today at that press conference that I showed the clip from earlier, Sununu essentially says that he's not going to issue shelter in place. He won't do it. And actually, you know what? Let me see if I can pull that clip up first, because honestly, that was pretty astounding. um, See if they had it on the WMUR YouTube. Excuse me, folks, here. Let me see. We are. Excuse the technical difficulties, folks. I thought I had this queued up, and I just didn't. I just totally, totally didn't make sure to deal with that ahead of time. So now I'm just kind of waiting through it. Okay, here we go. So put this over here, and we'll just switch this up. So this is here we go. This is from WMUR, and this was updated on the 20th. So this was from Friday. We'll just play this. Oh shoot, sorry folks, I just realized wasn't able to bring the audio back up for that, so we'll redo this right now. Okay, here we go.
As more states move to restrict
right.
non-essential business or institute shelter-in-place
right.
orders, Governor Chris Sununu says he does not anticipate New Hampshire following suit right now. He believes the measures being taken here, from social distancing to schools closing and the restrictions on restaurants and public gatherings, are appropriate for the state's known level of COVID-19 spread. And he says shelter in place is not imminent for New Hampshire.
These are all incredibly big decisions, and people are really abiding by them, and that's allowing flexibility at the top level to not make such drastic action. So we are absolutely not there today, and look, we always need to plan for the worst, but by no means are we in that position today, and we hope to never have to be.
Sununu acknowledges this is a fluid situation and things could change, but says the ultimate goal is to avoid overwhelming hospitals.
We're bending the curve. We talk about that a lot. You don't get a run on the healthcare system, and over time, that'll give us a chance to bring in more pharmaceuticals or drugs that can help mitigate the symptoms.
New Hampshire, like all of the other states in the U.S.
Did you just say we're bending the curve? Because that, anyways, I mean, I'll give it. That's a word slip, but come on, dude. That's like, know the language. Please know the language of what's going on right now. But look, he just said today that he wouldn't issue shelter in place. And I'll see if I can pull that clip up while I'm at it, actually, because this is really stunning, folks. Like, it's, we just got into triple digits on our reported cases, and it's like, and when that jumps 23 cases overnight, takes us up to 101, like that's a huge leap in a day. It's massive. So it's incredibly unreasonable to be thinking that like we're in safe shape on this. Because we're not. So yeah, actually, here we go. I do have the full video right here.
We come here today to update our citizens on some of the latest efforts in combating this crisis. Here in New Hampshire, we value individual and community responsibility. And in these unprecedented times, the people in New Hampshire truly have a great responsibility. We must be accountable to each other, and it's imperative that everybody stay safe. But people must make smart decisions and stay at home and keep using smart social distancing as much as possible. Many people are already doing this, but it is a message that we truly cannot repeat enough. Of course, we're not telling people they can't go outside and enjoy the outdoors, go on walks and hikes while practicing common sense social distancing. You can continue to do so, but please practice smart decision making and avoid all unnecessary situations that could put you or your neighbors at risk. How we act in these days and weeks ahead are going to be very important. If it becomes clear that we're unable to continue with the social distancing, further action may be necessary in order to ensure the health and safety of our neighbors. And to those over 60 and with other identified risk factors, it's important that you stay at home. Whether it's offering to pick up groceries for an elderly neighbor or shoveling their sidewalk during tomorrow's winter storm, it's imperative that we come together as a state. Also, in accordance with CDC guidelines, New Hampshire will now be issuing guidance prohibiting scheduled gatherings and events with more than 10 people. I'll now turn it over to Dr. Chan to give us our daily update of where we stand.
Great. Right. So that's that. And I mean, it's like to have the numbers hop that much and to basically have the same exact response that you had on Friday, is just, I don't know, it's not slick. So um yeah, this is ridiculous. So um and then again, we're over here, and this is his quote when he's talking about in regards to the flu. So I just want everybody to have contrast here. He's done a lot of positive things with his emergency orders, and he's clearly taking this seriously in the sense that he understands it's a problem. But the question becomes just how much does he understand it's a problem, especially when we have a lot of people flooding up into the state from out of state to their summer homes, and those people are now depleting grocery stores, particularly in the upstate areas. Like, whew, it's bad. So, at any rate, here's what he says. Like, once you get it, you remember 98% of the people that get it are going to get better. And we're going to have the flu, and then you're going to be immune to it, Sununu said in a radio interview on WRKO Friday. So there's an end game here to be sure. And it's not like the flu. It just isn't. And like it just purely doesn't behave like the flu in one sense that it operates like it has a totally different effect on our bodies. It is a respiratory infection. It is not. It's not the common cold. Okay, this isn't the sniffles. This is something very, very, very unique and very different. So, I would hope that folks can just take him with a grain of salt on that one, and remember that we could have a much better response to this. And for him to say, he's like, well, how do you undo that? How do you unwind it? I don't think that that's necessarily the question to be asking at this particular moment in time. A lot of people want to do the when this is all over kind of posting or talk, conversations, or it's like if you don't think that next year's seniors are at risk of not having a graduation or a prom too, then I would say you might not be thinking in the most realistic terms. This is very well a gigantic shift in the way our society works. We've never been through anything like this before. We're looking at a potential unemployment level of 30%. And we only hit 24 during the Depression, like the Great Depression. Our highest unemployment was 24. So it's important to understand that economically speaking, our country has never done anything like this. We've never, ever, ever seen anything like this at all. And I just thinking about what we're going to do when we get out of this is not going to help you get through today. What's going to help us get through today is making sure that we're not only helping the people that are closest to us, but we're doing things that make us happy right now. We're enjoying art, we're enjoying the company of our loved ones, we're reaching out to loved ones that aren't here. Reaching out to our friends that are not with us. We have the wonder of technology, so we can at least talk to folks. We can see them in real time. That's the stuff you got to do. Get creative. There are so many resources, and it's like there are a lot of things that I know I personally was setting off to the side that I'm about to move on again, because there's an opportunity to, and it's exactly what folks need right now. Positive creativity and production and caring about what's right next to you is what's going to get us through this. And I think we have this, and this is sort of my own personal bit talking. This is my own personal feeling on this. There's a way here for us to see globally, locally, if that makes any sense. There's a way to for us to relate our communities to each other in what our own individual struggles are. There's value in us reaching out to other leaders of other communities, other volunteers in other communities, seeing what works for them, what doesn't. We have that capability. And that interconnectedness is going to be different than having us all be doing that communication through major media outlets. If we're doing it through stuff like this show or other YouTube channels, if we're doing it through, game night meetups on Zoom, or you're playing D&D with your friends across the world, like that stuff that's going to build a sense of solidarity and community amongst people and amongst what is a global working class, essentially. Like this is going to help us relate to each other and find a way if let's say society were to truly collapse because of this, at least American society, this is a chance for us to truly rebuild this, to help not just the people at the top. This is an opportunity for us to build a more worker-centric and creative and open society. It's a chance for us to really take a swing at some of those reforms that we always wanted to deal with, but we were up against just the political backlog of nonsense. I mean, yeah, there's going to be a certain amount of upset because it's in a lot of ways destroying the way we've understood our own politics for a really long time. It's gonna turn everything over. A lot of the paradigms that we did utilize before are still going to be there, and they're still going to mean something, but the way that we apply them and the way that we utilize them is going to change, and who's backing what is going to change. And with that, I'm going to make this transition to, let's see here, this bit of nonsense.
I just wanted to take a minute.
So, here is Corky Messner on Twitter making a little video talking about obstruction. So, and I think he is talking about Washington obstruction. He's talking about the national stuff. So this is going to be our jump over the national segment. I'm going to show this clip, take a little break, and then I'll hop back into it. But here's this guy.
Good morning. I just wanted to take a minute and explain what happened last night in the Senate. There was a bipartisan negotiated deal. And then at the last minute, the career politicians on the Democrat Party came in.
Hold on. Not bipartisan. It's not bipartisan. I don't know. I don't know where he's getting that. But it's just not. What was proposed last night in the Senate was something that was done up by Mitch McConnell. Period. Okay? Mitch McConnell categorically said last week that he was not satisfied with what came through from the Democrats, and he wanted to do his own thing, that it was going to be, that it would gain bipartisan support. Not that it was bipartisan from the jump, but that it would gain bipartisan support, which, and that's that's not true. So continue.
And crush the deal because they wanted to add things to the deal that are purely political, that were purely part of the presidential election. And then at the
I don't know what he means right there. How is greater protections for workers and less like additional subsidy for corporate like I guess I can kind of see why it's a political argument, like why he would consider it a political argument, but after the little break, I'll get into like actually what's up with this and why nothing that's on the table right now is frankly acceptable from a worker perspective. Okay, it's just not. So I'll let this guy do his thing here. I'm sorry, I keep cutting him off.
and crush the deal because they wanted to add things to the deal that are purely political, that were purely part of the presidential election. And that's why they didn't vote for the deal. So the country is hurting. The country is in crisis. And our career Democrat politicians from New Hampshire, and you know who I'm talking about, are putting petty politics ahead of the Granite Staters. That's what's going on here. They are utilizing and leveraging this crisis for their own political gain. Make no mistake, that's what's going on here. That's why you need to send me to the U.S. Senate, because I'll be fighting for you. I will be focused on you. And keep in mind, this package.
I don't know if he knows this, but Shaheen was working on stuff with Senator Collins and a bunch of other conservatives. So I don't know what he's talking about. I like right there. I have no idea what he's getting at.
Package that the Republicans have proposed includes a lot of money for small businesses to be lent to small businesses, which won't have to be paid back if those small businesses use that money to pay employees. Think about that. Think about that.
Okay. Well, I'm going to take a quick moment to just kind of stretch myself and get a couple things together, and then we'll be back, shortly. And, yeah, so hang in there, folks. We'll do sort of more of the national side of things after the jump. So I'll see you in a moment.
Mitch McConnell are trying to put a corporate bailout ahead of millions of families. You know, it's families. It's simply wrong. We should be focusing on families. The White House and the United States Senate Republicans have proposed a $500 billion slush fund for corporations with almost no conditions. And you don't have to tell Americans where it's going to go for months. You don't have to explain what you did with it. The Trump administration could allow money for stock buybacks, for executive pay. Republicans refuse to increase Social Security at the same time, to forgive student loans, to take the necessary steps to stop evictions, ensure food and nutrition for vulnerable families. Senator McConnell should immediately allow a bipartisan vote on aggressive measures to help small businesses, workers, communities, so they reflect what they need and so they can get moving, so we can help them now. This is a time to help families, communities, and small businesses. People trying to pay their mortgages or their rent, student loans, urgent bills, they need help. They shouldn't have to pay for a corporate handout before they get the help they need. They need the help now.
All right, folks. So that's sort of Biden's little announcement there. This is what we get, that little segment after over a week. I don't know where he was. Sanders has been having panels with experts and other Congress people. You know, he met with the squad last night. I know a lot of people are criticizing that because they whatever, but frankly, he's met with a bunch of professionals within the medical field. He's met with epidemiologists. He's done those live streams too, so I just don't want to hear any excuses. At any rate, and today he just won with Americans abroad as well, by a pretty wide margin. So it's, you know, the Democratic primary is just, oh God, it's just a mess right now. This is such a mess. You know, I don't know what Biden's done. I really don't. This is all that we've gotten from him, essentially. Meanwhile, Sanders raised $2 million and has been out here just streaming hours virtually every single day to connect with the American people and try and help us feel a sense of solidarity, feel a sense of community. I know that that's what they're trying to do. I'm not saying even that they're succeeding in it. I know that's the effort that they're putting in. And I don't see that same effort coming from Biden. And generally speaking, I see Trump yelling at the press every day. So, maybe I'd feel differently. Maybe we'd have a different take on it if there were other people still running in the race, but they're not. So I don't see a point. But it's, there are other things that came out of this today. And, it's like after all this time, here we are. We've been waiting for Biden to come back. Been waiting a good minute for this guy to show back up again. And then he gives us, he'll give us moments like this. So this is I'll just let this speak for itself.
Beef up the number of responders dealing with these crush of cases. And in addition to that, we have to make sure that we are in a position that we are. Well, let me go to the second thing. I've spoken enough of that. The president must use the Defense Production Act, beef up the number of responders dealing with these crush of cases. And in addition to that, we have to make sure that.
How do they not have this stuff figured out? And how does he just this is silly, guys. This is silliness right here. This is absolutely ridiculous. So So there's our man Joe. Fighting for the average American, trying to stop corporate slush funds. Righto. Yeah, thanks, Joe. So, at any rate, now that he's back, everything's fine, right? Like, everything's totally cool. Everything's gonna work out. No, I don't know. I don't know what this is, but it's a little ridiculous. What he is talking about, though, is this is the part that I kind of want to get into a little bit, because this is the thing that I think this is what people care about right now, in terms of, because it's what affects the relief that everybody will get, which is them getting a stimulus package through that gets money to Americans. Now, I have been kind of like, I hadn't had a chance to sort of like dig too deeply into it, and it's been really rapid fire lately, but I did have a chance to actually pop up the actual, what I have here and what we can go over and put them side by side is the House bill versus the Senate bill. We'll just have a look at the two of them together. So right away, what we've got here is this is the House bill that was offered up, and it's essentially what they're saying they want to do here is really just expand everything that's already there. They just want to broadly expand it without specifics. I mean, at least that's what they're talking about in this particular summary. If you get into the bill text, it's going to tell you more details, obviously, about this stuff. But basically, it's about getting appropriations to the Department of Agriculture for food assistance programs and stuff like that. Primarily nutritional stuff. Seeks to modify food assistance nutrition programs to allow waivers for school meal programs, kind of like what we've got going on here in our community, where we have they're delivering meals. Suspend work requirements for the SNAP program. Allows states to request waivers to provide certain emergency SNAP benefits. Asking for OSHA to do an emergency temporary standard to develop, like you got to have a plan in your workplace to deal with infectious disease spread. I mean, goes on as, this bill also includes provisions that establish a federal emergency paid leave benefits program to provide payments to employees taking unpaid leave due to the coronavirus outbreak, expand unemployment benefits and provide grants to states for processing and paying claims, require employers to provide paid sick leave to employees, establish requirements providing coronavirus diagnostic testing at no cost to consumers, treat personal respiratory protective devices as covered countermeasures that are eligible for certain liability protections, and temporarily increase the Medicaid federal medical assistance percentage. So it's general increases. I read this and my initial thing is like, hey, where is the money for people? Like, cool, where? This sucks. Like, this is, in my opinion, pretty trash. Because it doesn't help anybody, really. I mean, this is a very, like, this is what an affluent person thinks helps. Like this is what I would imagine somebody who's really wealthy, who like thinks that they're a really good person, they're really like philanthropic. I would imagine this is the type of thing that they would put together because it's like, well, this is, it's based off of what we can get done. It's like, it's based off of what will work within the system. Please excuse the beeping. It's not, yeah, this is pretty weak. Okay. This is pretty dang weak. And it leaves a huge opening for conservatives to come in and beat Democrats on their left. Like, literally, there's an opening that's created here for conservative legislators to develop stuff that's going to be more friendly. And what did they do? They got super enthralled with cash payouts. So now we'll move over to McConnell's Senate bill, which is what we got right here. This is the CARES Act, in contrast to the Families First Act. Is it? Yes. Families First Coronavirus Response Act. So this is in contrast to the Coronavirus Aid, Relief, and Economic Securities Act, or the CARES Act. So this is worded in like pretty, like, fairly strictly economic terms, which is, I am not surprised coming from the people that like are there. It's like, this is like economics is your religion type of stuff, or your second religion, or whatever. But at any rate, so they start off right away with small businesses, and talking about suspending excise taxes. People love the sound of tax break. They just do. They just love tax break. And, like, anytime it's like, I wish that it would apply also to corporate tax breaks, but for some reason it doesn't for everybody. I don't know. I don't get it. Anyways, with respect to small businesses, the bill establishes and provides funding for forgivable bridge loans, and provides additional funding for grants and technical assistance. Okay. The bill also provides funding for $1,200 tax rebates to individuals, with additional $500 payments per qualifying child. The rebate begins phasing out when incomes exceed $75,000 or $150,000 for joint filers. So this one includes a cash payout. Now, what I'll say to that is also crap. Also total crap. Like, I don't know where they think that $1,200 one time solves anything for anybody, but it doesn't. This is written like this is going to be over in 2 weeks. This is written by a bunch of dudes, generally speaking, a bunch of old white dudes who think this is going to be over quickly, or don't, care about appeasing everybody to make sure that they gain support, but maybe don't necessarily actually care. They're just more interested in outfoxing the Democrats. And that's actually what McConnell basically copped to in his press conference that I covered last week. So, like this was all pretty naked, that this was what was happening. And I think it's funny that, like, the media today has really bought into it and is just, like, viciously coming down on Democrats. Like, it's a joke, man. It's a total joke that this is happening because, like, honestly, like, I don't know. This doesn't say, this isn't me saying that, I still personally haven't come down on how I feel about whether or not they should let this through. My initial inclination is no, because I really don't want to see a whole, like, I don't like that there is an opportunity for corporations to seriously take advantage of the tax breaks that they're getting through this when workers really get a one-time payout. Like, this is no different than the original tax bill the Republicans passed through originally, when they said, they're going to help the middle class out like crazy, going to help the lower classes out like crazy. And honestly, most people's taxes went up. Like, maybe they saw a slight bump in their pay, like just a little bit, like right when it went in, they saw like a little bit. Some did. And then it was over. You know what I mean? Like, there was nothing after that. And then everybody paid a ton more in taxes the following year. And like, people that were getting returns all of a sudden had to pay, which is wild. So yeah, like, that's not enough. That's silly. That's totally silly. So, and this summary doesn't really talk about like the details of it. And when you get into it, it is a little bit like, the tax breaks are essentially relief. Like, it's a lot of relief for corporations that, it's like, there's something to be said. I saw an interesting debate on, I saw an interesting debate last night that was, and like, whether or not the Democrats should have let this go through. And whether or not this is about partisan politics. And I think my personal take on it is like, I don't know that this is, I don't know. I don't know if this is really the time for us to be like, I genuinely can't tell if this is the appropriate time for us to be dissolving that political reliance or that type of like team on team, like red team, blue team stuff. Like, I definitely think there's absolutely a ton of shady stuff happening on like behind the scenes, what the Republicans are doing here with this stuff. And I think the Democrats are just like not willing to deal with it. Like, they're not willing to take the steps. And especially when you have, people like Sanders out here calling for $2,000 a month until this is over. We're talking about calling for complete student debt relief, not just a partial cancellation or, you get this much off if you did it. No, screw it. Either cancel it all or don't do it. Like, just, like, this isn't, and honestly, don't not do it. Just cancel it all. That's it. This is where we're at. Like, if folks can't understand that this is essentially the end of the American economy as we know it, in all likelihood, the restaurant industry is basically about to collapse on a national scale. We're not just facing those problems locally where like you've already got businesses that are forced in a takeout only. And then as we're speaking, as I've been shooting this episode, it starts snowing like crazy. So let's think about this, folks. Let's think about the long term here. Let's think about the big picture. Let's think about that game. So I want to pop up this Pelosi statement for a second. This was her today. So here she is, and I'm just gonna let this roll for a second.
Good afternoon. Health institution of members of Congress. Thanks. Years ago today, on March 23, 2010, President Obama signed the Patient Protection and Affordable Care Act into law. On that proud day, we took a monumental step forward for the health and financial security of the American people. We expanded new health coverage to 20 million people and delivered better coverage to more than 150 million Americans with health insurance through their employer. We passed the Affordable Care Act because we believe that in the United States of America, Healthcare must be a right, not a privilege. The late Senator Ted Kennedy made that belief the fight of his life. Thanks to the leadership of President Barack Obama, who was dedicated, knowledgeable, strategic, and determined to succeed, thanks to the clear vision of our committee chairs crafting the legislation and the deep courage of members of Congress, thanks to outside mobilization of patient advocacy groups, Nuns on the Bus, March of Dimes, Protect Our Care, Little Lobbyists, and others, the Affordable Care Act stands today among the great pillars of American health and financial security: Medicare, Medicaid, Social Security, and the Affordable Care Act. Now we find ourselves in the depths of one of the most serious health and economic emergencies our nation has ever faced. The protections of the Affordable Care Act are more important now than ever. But right now, in the middle of the coronavirus, the Trump administration is in court suing to tear down the entire Affordable Care Act, every last protection and benefit. If President Trump succeeds in striking down the ACA in court, gone is the ban on insurers putting limits on your health care. Gone are guaranteed essential health benefits and free preventive services. Gone are young people staying on their parents' insurance until age 26. Gone is the health insurance of 20 million Americans. And gone are the life-saving protections for more than 130 million Americans with pre-existing conditions. Today, therefore, I'm calling on President Trump to abandon his lawsuit seeking to strike down the Affordable Care Act. Instead, the president should urge the 14 states who have refused to expand Medicaid to do so. Last Thursday, Pope Francis offered the world this prayer: enlighten those responsible for the common good so that they might know how to care for those entrusted to their responsibility. Today, House Democrats are unveiling the Take Responsibility for Workers and Families Act, a bill that takes responsibility for the health, wages, and well-being of America's workers. Democrats take responsibility for our workers. We require that any corporation that takes taxpayer dollars must protect their workers' wages and benefits, not CEO pay, stock buybacks, or layoffs. We strengthen unemployment insurance so that it can replace the average wages of our workers who are losing their jobs and hours. For our small businesses, we provide fast relief with grants and loans to tide them through this crisis. For our doctors, nurses, healthcare workers, and first responders in hospitals and other health institutions, we provide desperately needed funds to care for those who are sick and to ensure that our providers have personal protective equipment, PPE, that they need. We protect our healthcare workers by requiring the administration to enforce our stronger OSHA protections. For our families, we give direct payments to America's families in a robust way and strengthen the child tax credits and the earned income tax credit. We give more workers the security of guaranteed paid family and medical leave, including those caring for our seniors. And we make the coronavirus treatment free for the patient. For our students, we provide emergency funds for our schools and universities. We help current borrowers with their student debt burden and the GI Bill benefits. We bolster SNAP and other initiatives to address food insecurity. For our democracy, we ensure that states can carry out this year's election and require early voting and vote by mail. I'm grateful to our committee chairs and members for their extraordinary leadership and work for America's workers and families. The Senate Republican bill put corporations first, but because of the insistence of Leader Chuck Schumer and Senate Democrats, progress has been made. We urge the Senate to move closer to the values in the Take Responsibility for Workers and Families Act. We must be bold and forward-looking in our thinking. We must be swift and evidence-based in our actions, and we must be prayerful. God bless the families of those who have lost loved ones and those fighting this terrible illness now. God bless our nurses, doctors, first responders, and men and women in uniform. God bless the men and women in our factories making medical supplies, cars, all of it, and those keeping our grocery shelves stocked with food. God bless the scientists racing to find a cure. God bless all of you, and may God always bless America. Thank you.
A cure?
Thank you. Okay? Got the essence of our bill.
You intend to bring the House back to vote on the bill that you're going to introduce this afternoon?
We'll see what we're going to do. That is our hope, yes. But we'll see what the Senate does, too. We're still working.
There's still an opportunity. Do you see it in the House if you get a Senate deal?
Well, there's too many theoreticals here.
Thank you.
Okay. So, I mean, like, it sounds better, I guess. We'll see. We will absolutely see if it's better. I am dubious, and I hope this doesn't turn into a political football that just gets kicked back and forth over the next damn week. But, because I don't know how anybody is going to make rent or their mortgage payments or whatever come the beginning of April. I don't know how anyone's doing that right now. Everybody's in deep, unless you're some super sweet work from home person who's got a nice non-affected industry job. So at any rate, I will get into whatever they're talking about tomorrow. I'll follow up with some more updates. We'll see what happens when we get the report from the state on today's information. I'm sure it's already worse, but we'll see what happens. And the plan here is to be back on, Wednesday. We'll be doing this again on Wednesday. So definitely keep your eyes peeled for that. We'll have posts ahead of time. So hopefully just, get the word out earlier on in the process. And it'll be good. I hope everybody's, I hope this is helping folks. I do really, again, it's my hope to get more interview type stuff on here and to get that kind of thing lined up. I might have something for Wednesday, I might not, but we'll see how that goes. I hope to get more creative stuff up here. I know that separately, I'm doing DJ sets like once or twice a week right now for everybody. So that's something to keep out for, if, just in a totally separate effort that I just, for folks. So, but if you got a talent like that, please be willing to, consider sharing it. You don't have to be willing, I guess. I'm not forcing anybody to do anything, but definitely feel comfortable sharing it, because what else are we going to do right now? Folks, this is a whole thing. So at any rate, cheers. We'll catch y'all on Wednesday. Everybody, have a great evening. Please talk to a loved one, talk to some family, talk to some friends. Watch a movie, read a book, play some board games, do what you got to do. I don't care. But stay happy, because it's going to be okay, folks. And we're, as I've heard repeatedly throughout my life, we're all in this together. So take care. And we'll catch you tomorrow, all right? Later.
It's sort of a feeling, I think, a melodic feeling, or just say a certain kind of a thing, to try to maybe show somebody something through music, even show myself something, because as I've discovered it myself, it's been a revelation to maybe reveal something to someone else through the music, something that's good, and something that they feel that maybe enriches their life a little bit, or makes them feel better as a person, or something like that.